A comprehensive guide to health insurance, AZ Health Insurance Terms Explained. Introduction. Health insurance is a crucial aspect of financial planning and well-being. Understanding the various terms and concepts associated with health insurance can help you make informed decisions when choosing a plan and using your coverage effectively. In this comprehensive guide, we will explain AZ Health Insurance terms, demystifying the often complex language used in the industry. A. Actuarial value. Actuarial value is a percentage that represents the average amount a health insurance plan is expected to pay for covered benefits. It helps consumers compare plans. For example, a plan with an actuarial value of 80% means, on average, it covers 80% of healthcare costs, with the remaining 20% paid by the insured. B. Beneficiary. A beneficiary is an individual named by the policyholder to receive the benefits of a health insurance policy in the event of the policyholder's death. C. Copayment, copay. A copayment is a fixed amount you pay for a specific covered healthcare service, such as a doctor's visit or prescription medication, at the time of service. Copayments are usually defined in the insurance policy. D. Deductible. A deductible is the amount you must pay out of pocket for covered healthcare services before your insurance plan begins to pay. Higher deductibles often result in lower monthly premiums. E. Exclusion. An exclusion is a specific service or condition that is not covered by your health insurance policy. It's essential to review these exclusions to understand what your plan does not cover. F. Formulary. A formulary is a list of prescription drugs covered by your health insurance plan. Drugs on the formulary are typically grouped into tiers, with different copayment or coinsurance amounts for each tier. G. Grace period. A grace period is a specified period, usually 30 to 90 days, during which your health insurance coverage continues even if you miss a premium payment. Be aware that claims incurred during this period may not be covered if the premium remains unpaid. H. Health Maintenance Organization, HMO. An HMO is a type of health insurance plan that typically requires you to choose a primary care physician, PCP, and get referrals to see specialists. HMOs often have lower out-of-pocket costs but less flexibility in choosing healthcare providers. I. Network provider. An in-network provider is a healthcare professional or facility that has a contract with your health insurance company to provide services at a negotiated rate. Using in-network providers usually results in lower out-of-pocket costs. J. Job-based health insurance. Job-based health insurance is coverage provided by an employer to its employees. It can be offered as part of an employee benefits package, and both the employer and employee may contribute to the premiums. K. Kidney dialysis. Kidney dialysis is a medical procedure that filters waste and excess fluids from the blood when the kidneys are no longer functioning correctly. Most health insurance plans cover kidney dialysis as an essential service. L. Lifetime maximum. The lifetime maximum is the maximum amount of money your health insurance plan will pay for covered healthcare services over your lifetime. The Affordable Care Act eliminated lifetime maximums for essential health benefits. M. Medicaid. Medicaid is a joint federal and state program that provides healthcare coverage to low-income individuals and families. Eligibility and benefits vary by state. N. Network. A network is a group of healthcare providers, including doctors, hospitals, and clinics, that have agreements with your health insurance company to provide services to plan members. O. Out-of-network provider. An out-of-network provider is a healthcare professional or facility that does not have a contract with your health insurance company. Using out-of-network providers typically results in higher out-of-pocket costs. Premium. A premium is the amount you pay for your health insurance coverage, typically on a monthly basis. It is a regular expense to maintain your insurance policy. Qualified Health Plan, QHP. A qualified health plan is a health insurance plan that meets the standards set by the Affordable Care Act, ACA. QHPs offer essential health benefits and adhere to specific consumer protections. Referral. A referral is a recommendation from your primary care physician, PCP, to see a specialist or receive specific medical services. In some health insurance plans, referrals are necessary to see specialists. Self-insured. A self-insured health plan is one in which an employer assumes the financial risk for providing healthcare benefits to its employees. These employers often hire a third-party administrator to manage the plan. Third-party administrator, TPA. A third-party administrator is a company hired by an employer or insurance company to process claims, manage benefits, and perform other administrative functions related to health insurance plans. Underwriting. Underwriting is the process health insurance companies use to evaluate an applicant's risk and determine whether to issue a policy, what coverage to provide, and at what premium rate. Vision insurance. Vision insurance is a type of coverage that helps pay for eye exams, prescription eyewear, glasses and contact lenses, and other vision-related expenses. It is often offered as a separate policy or as part of a broader health insurance plan. Waiting period. A waiting period is the time you must wait after enrolling in a health insurance plan before some or all of your coverage becomes effective. Common waiting periods apply to pre-existing conditions. X-ray. An X-ray is a diagnostic imaging technique that uses ionizing radiation to create images of the inside of the body. Health insurance plans typically cover X-rays when they are medically necessary. Why yearly maximum? The yearly maximum is the maximum amount your health